with you guys. So we're going to continue our discussion of arthritis and joints and kind of the biology of how our synovial joints work. So you guys see that okay, that cartoon? Yeah? All right, friends. So synovial joint. So the anatomy of it, this is just obviously a cartoon, but this is analogous to essentially what our knee looks like because we have this sort of rounded trochlear surface on top of these parts of the tibia. Usually the meniscus would reside in here, but it's not even showing that fibrocartilage. So this is just looking at a very simplified version of a synovial joint. Most joints in our body are synovial joints unless they're sort of so most joints that have like actual muscles creating motion around them. So the joints in our fingers, the joints in our hips, our shoulders, most of the time when you talk about joints, you're talking about these kind of joints. Because I think something like 95% or 98% of all the joints in our body are actually synovial joints. So you have this bone, and then you have this surface of the bone. The shape of the surface of the bone is what determines that potential movement, along with the ligaments around those two bony connections. So ligaments, which are not, oh, I guess they're kind of showing it here. See, it's this outermost capsule. So they've removed skin, fat, fascia, muscle, and then this is sort of the cartoon experience that we get. Okay, so we have these ligaments, remember, binding bone to bone. And on the inner surface of the joint capsule, which is kind of a lot of times just an expansion of the innermost ligaments of the joint, you have these, I think of it like a inner cloak. You have this special like inner cloak on the inside. You know how sometimes coats will be lined on the inside. You have this inner lining of the joint capsule, which is actually a special group of cells that produces synovial fluid. And this synovial fluid is nourished by arteries and veins. And so it does get oxygen, it does get glucose, all the things that we need in order for joints to be able to breathe, right? Because remember, these little caps here of cartilage, I talked about cartilage last time, don't have active blood supply going to them. So they receive nourishment, remember, passively. I talked about that a lot last time. So that if you don't weight bear on an evenly across these two surfaces through the full range of motion of their available surface, then you start to create cell death or cell starvation at the cartilage level. And then conversely, like, or also I should say, if you weight bear and then you slip these joints, so usually it would be this joint slipping on top of this joint because we're weight bearing here. And when that happens, that sort of, again, erodes those cartilage cells. It tears them down. They're not meant to sustain compression in that region. But that's not the whole story of osteoarthritis, because after you start to kill off cells, what is a natural byproduct? What has to happen is that your immune system has to respond, because you need a cleanup crew. You need like Caltrans to come in and go, oh crap, here's all these broken down dead cartilage cells. We need to remove this debris, get it out of here. So your body launches an immune response, and that immune response is generalized. It's its first stage of immune response, and it's global. It's inflammation. And remember, inflammation gets a really bad rap. I hear people say, even medical doctors use inflammation to craziest sorts of associations, but all of us need and want a healthy inflammatory response. It is the first stage in any sort of protection that our body has. And especially when we hurt ourselves, when we debride our own cells, right? So we have to have this inflammatory response come in. This inflammatory response does a couple things. And because one of the things that it does is, because there is active blood supply going to this synovium of the joint capsule, it starts to create inflammation. And so sometimes that will be called like a synovitis, right? So we'll have this inflammation of these cells and inflammatory signals in this space within this region. The body does something really amazing when you start to have inflammation here, because you sort of expand blood cells, and there's all this cell material rushing to that area. White blood cells, the really famous ones, are the phagocytes that gobble up old debris and eat old debris, right? We want all that to happen. But your body goes, oh my gosh, there's too much fluid in here. I can't use this joint normally, right? Which is, inflammation is a cyclical byproduct of osteoarthritis. And so your body does something really smart. It goes, I'm going to tell part of the inflammatory response reaction, sort of the secondary response reaction, is to tell these ligaments and this joint capsule to get stiff. When those ligaments in that joint capsule get stiff, it limits naturally the inflammatory response. I think this is absolutely stunning. How incredible, even with just such a simple sort of mechanism as osteoarthritis. So these ligaments and this joint capsule get stiff. Now, interestingly, when you're a manual therapist, when you do manual therapy, you're a physical therapist, you can feel this particular type of stiffness. It has a particular felt sense. It's like coffee has a particular scent. Every tissue, limiting joint range has a particular feel. You can learn to feel it with your hands. We start to teach that in school, hopefully, or with our clinicians. So it will have a felt sense to it. And we call it in the clinic a capsular end feel. It means that the joint capsule has stiffened and is limiting motion. This is a really important point of intervention for you to receive care on, because when you go to a good manual physical therapist, they can do joint mobilizations they can figure out based on their hands and based on some objective measures of range of motion, they can figure out which part of this three-dimensional capsule has gotten stiff, which part of the fibers. Isn't that amazing? I mean, if you just like mic drop right there, that's plenty. But what they can do is they can help you restore motion specifically in the place where you need it. And then what that does, that's really important point of intervention when you have a cyclical process going on. If you don't have that restoration of motion, you're going to continue with stiffness. And all of us have felt that at arthritic points in our body. Why doesn't stretching, like flexibility work, specifically address ligament stiffness? And the answer is because when you're doing something that takes up slack in a lot of other tissues, in the slack of your fascia, in the slack of your muscle, in the slack of your nerves, you're not targeting specifically joint capsules. So you may be running into end ranges in these other tissues. Plus, the other danger is you might not need length in those other tissues. So now here you are maybe increasing the length, say, in hamstring muscle or tendon, and that is further exacerbating this arthritic condition. So seeing a provider when you have osteoarthritis is imperative, and working on establishing more normal capsular motion is something that I hope we're all kind of undergoing after we have kind of a trauma or after we have a diagnosis of osteoarthritis, whether that be a bunion, whether that be at our ankles, at our knees, at our shoulders, wherever it is, right? We need some help when we have that. We can help slow down the progression of our osteoarthritis, but we need help. We need manual therapy, and we need the right kinds of exercises so that we are creating better stability, right? So we're weight bearing or using that joint more evenly and pulsing fluid across those cartilage surfaces more easily, more efficiently. And then we're also getting better motion across these ligaments of our capsule, okay?